Have you ever stopped to wonder who's really looking out for your health and safety at work? I mean, beyond that basic first aid kit you see in the break room, we're talking about this whole system, really, of prevention and support. It often operates completely behind the scenes, making sure you're okay in ways you might not even notice until you need it, of course. So today we're doing a deep dive into occupational health services. You might hear them called OH services. You've given us some great sources, definitions, roles, articles, and our mission here is to sort of cut through the official language. We want to distill what these services really do for you day in, day out.
Exactly. And we're going to explore their core purpose first off. Then the very diverse team of professionals involved. It's quite a mix. And the range of things they actually do, it's surprisingly broad, much more than just reacting to accidents. I think you'll have some aha moments about how connected work and well-being truly are.
Okay, let's unpack this then. We hear occupational health, and it sounds, well, pretty formal, maybe a bit clinical. What's the fundamental idea? Where do we start with their main mission?
Well, probably the most foundational place to look is the International Labor Organization, the ILO. They have this thing called the Occupational Health Services Convention, C-161. It's an international standard. And it defines these services as services entrusted with essentially preventive functions and responsible for advising the employer, the workers, and their representatives on the requirements for establishing and maintaining a safe and healthy working environment, and, importantly, the adaptation of work to the capabilities of workers.
Okay, preventive functions and adapting work. That's key.
Yes. And our sources really broaden that out. They talk about the promotion and maintenance of the highest degree of physical, mental, and social well-being of workers in all occupations, so everywhere, by preventing departures from health, controlling risks, and adapting work to people and people to their jobs.
Wow. Physical, mental, and social well-being. That's huge.
It is. It's a really holistic scope. It's not just about avoiding physical injury.
Right. So it's not just, reacting when something bad happens, like an accident or someone gets sick. It's actively trying to stop problems before they start. And that bit about adapting the work to the worker, that seems crucial, both physically and mentally.
Absolutely. And you picked up on the social well-being part, too. That's often overlooked.
Yeah, I was wondering about that. What does social well-being mean in a work context for these services? How do they influence that?
That's a great question. It can cover quite a lot, actually. It might involve helping address issues like workplace bullying or harassment, things that really impact your sense of psychological safety, or promoting positive team interactions, maybe supporting someone returning after a long absence where they might feel isolated.
Okay, so creating a supportive atmosphere.
Exactly. Fostering an environment where people feel respected, connected, because those factors directly hit mental health and eventually even physical health. It really shows how much our work environment shapes us.
Okay, so we've painted this picture of OH services as this, comprehensive shield for well-being, a really broad mandate. But a big vision needs people to make it happen, right? So who are the people doing this day to day? It sounds like it must be more than just one person.
Oh, absolutely. It's a multidisciplinary team, definitely. Providing this kind of service takes a whole range of professionals. Think of it like a specialized kind of medical and scientific squad focused just on the workplace. Our sources give a good hypothetical example. Say a worker starts having, breathing problems. An occupational health nurse or physician might diagnose and treat the immediate issue, but then the team digs deeper.
Right.
And an occupational hygienist investigates the workplace itself. Maybe there's poor ventilation or some kind of allergen they find. And then perhaps a CT engineer or an ergonomist comes in to implement controls, change the setup, so it doesn't happen again to anyone else.
Okay, so it's a whole process. Identify, diagnose, find the cause, fix it.
Precisely. A full cycle. So let's break down some of those key roles. First, you have the occupational health physician. Now, this isn't just any doctor. It's a specialized branch of medicine. These physicians are trained to diagnose and assess health hazards and stresses specific to work environments. They do the statutory medicals. Those are the ones required by law for certain jobs.
Right, like for pilots or something?
Potentially, yes, or people working with specific hazards. They also do health surveillance required by regulations. Like in the UK, there's COSHH, Control of Substances Hazardous to Health. If you work with certain chemicals, you need regular checks. That's under their remit. And they do other assessments too. Pre-employment screenings to check fitness for a role, post-sickness checks, rehabilitation support, even assessments for ill health or retirement.
So they really understand that link between the job itself, the tasks, the environment, and your specific health.
Exactly. They have that specialized focus. Now, next up is the occupational health nurse. And their role is, well, it often surprises
How
people.
so?
Because while they're fully qualified nurses, their main job isn't usually the immediate hands-on treatment of injuries like basic first aid. Instead, they are heavily involved in proactive prevention of illness and managing longer-term care programs within the workplace context.
Okay, so less about stitches, more about strategy.
You could say that.
Yeah.
For instance, imagine someone's getting wrist pain from computer work. The OH nurse might be the one to notice that trend early. They investigate the workstation setup, talk to the worker, maybe advise on ergonomic changes, or refer them for physiotherapy before it becomes a chronic problem.
Ah, I see. Spotting patterns and intervening early.
Exactly. They also help ensure the company follows health regulations. They monitor overall employee health trends, run health promotion campaigns, advise on ergonomics generally, and they might even help manage sensitive issues like substance misuse support programs. So the nurse title can be a bit misleading if you only think of hospital nursing. Their focus is very much prevention and management within the work setting.
That makes a lot of sense. They sound more like health managers or advocates within the company.
That's a good way to put it. Then you have the occupational hygienist. These are the real workplace environment detectives.
Detectives, I like that. What are they detecting?
Hazards. But they don't just spot them, they measure them scientifically. If there's a concern about dust levels, chemical fumes, noise, heat, vibration, anything in the physical environment that could harm health, they investigate. They use specialized equipment, maybe personal monitors worn by workers, or static samplers placed in the work area to get actual data on exposure levels.
Okay, so they're the ones who can tell you if the noise level is just annoying or actually dangerous.
Precisely. They quantify the risk based on scientific standards. Once they know the level of risk, they advise on control measures, ventilation, process changes, protective equipment, and provide training to prevent illness. They deal with the physics and chemistry of a safe workplace.
Got it. Very specialized.
Very. And supporting them, you might also have occupational health technicians. That's a growing role, assisting with things like health surveillance tests under supervision. And sometimes you hear the title Occupational Health Advisor, which is often used for experienced OH nurses, perhaps with additional qualifications. So altogether, it's this whole network.
It really is an ecosystem, isn't it? A whole team of different specialists all working together. It's like having, I don't know, a personalized health guardian for your entire career path within that company, constantly watching, advising, protecting. Okay, so we know who the players are on this team. Now let's get practical. What do they actually do all day? What are the specific things these services provide that you might encounter?
Right, the activities. They're incredibly varied, as you can imagine, covering prevention, assessment, support, all sorts. Let's start at the beginning of employment, pre-employment or pre-placement screening. This is basically about checking that you're mentally and physically fit and, crucially, suitable for the specific demands of the job before you start. Sometimes it's a legal requirement, a statutory duty. Like in the UK, if you work with ionizing radiation, you need to be certified as a classified person by a special doctor. Other times, it's more about general suitability, assessing if someone is medically fit for tasks like working at heights or driving heavy machinery to ensure their safety and others. It's about preventing a mismatch from day one.
Okay, setting people up for success safely. What about when someone's been off sick for a while?
Good question. That leads right into return-to-work rehabilitation programs. This is so important. After a longer absence, maybe due to illness or an injury, OH services provide vital advice and support. They don't just sign you off as fit. They often work with you, your manager, maybe your own doctor to create a plan. Often it's a phased return, gradually building up hours or duties based on your current capabilities.
Right, easing back in.
Exactly. They help tackle both the physical hurdles and sometimes the psychological ones too, like anxiety about returning. They might even bring in outside specialists, like occupational therapists, to help design the best possible plan for you. The aim is a return that lasts.
That sounds incredibly supportive.
Can be. And related to that is sickness absence management. This is often more than just HR tracking days off. OH might be involved in collecting fit notes or medical certificates, making contact during absence, conducting assessments to understand the health issues, and sometimes they can even facilitate or refer for treatment to help speed up recovery. For example, referring someone with back pain for physiotherapy quickly, maybe through a company scheme which gets them better and back to work faster. It benefits everyone.
So they can actually help you get treatment faster sometimes.
In some cases, yes, if the employer has arrangements in place. Then there's counseling. Many OH services offer confidential support, a listening ear, for employees facing difficulties. These might be work-related stresses or personal problems that are impacting work. This is huge for managing stress, anxiety, maybe dealing with trauma after a workplace incident. Having that impartial professional support available can make a massive difference.
Definitely. It sounds like they're involved across the whole employee experience. What about preventing problems before they lead to absence or stress?
Absolutely. That's the core idea. That's where proactive risk assessments come in. OH professionals are often key players here. They get involved in assessing risks related to, say, display screen equipment, your computer setup, or exposure to hazardous substances, or the risks from manual handling jobs.
Like lifting heavy boxes.
Exactly. And general ergonomics, looking at how workstations or processes might lead to musculoskeletal problems, even advising on the right, personal protective equipment, PPE. By being involved proactively in the risk assessment process, they help build health considerations right into the company's safety management system. It's about stopping illness before it starts.
Integrating health into safety from the ground up.
Precisely. And they also do health education and promotion. They know your health isn't just about work. So you might see OH teams involved in national campaigns like Stop Smoking Day, offering advice on healthy eating or exercise, maybe helping draft company policies on things like smoking or alcohol, promoting overall wellness.
Right. Now, you mentioned earlier some different terms. Assessments, surveillance. Can you clarify those? It sounded important.
Yes, it's a crucial distinction and often causes confusion. Let's break down health assessments, health surveillance, and medical surveillance. Think of a health assessment first. This is usually a one-off medical check, perhaps when you're returning from sickness absence, or maybe changing roles. An OH physician or nurse does it. The focus is on your current fitness for your specific job. How does the job affect your health? How does your health affect your ability to do the job safely?
Okay.
It might lead to recommendations like phased return or adjustments to your workstation or duties. It's tailored to your situation right now.
Got it. Like a specific checkup related to the job. What about health surveillance?
Health surveillance is different. It's systematic, regular, and ongoing. And it's done because there's an identified, measurable risk associated with the job itself.
Ah, okay. Because of a known hazard.
Exactly. Like exposure to certain chemicals or dust or high noise levels. There's usually a baseline check before you start the hazardous work to make sure you're fit for it. And then routine follow-up checks at regular intervals to detect any early signs that the work might be harming your health. For instance, someone working with flour dust in a bakery might have regular lung function tests to catch the very beginnings of occupational asthma. It's proactive monitoring for specific, known job risks.
Okay, so surveillance is like regular check-ins because the job itself has known risks. That makes sense. And medical surveillance, that sounds even more serious.
It generally is. Medical surveillance is usually mandated by specific, strict regulations for exposure to particularly hazardous substances. Think asbestos, lead, ionizing radiation. These assessments have to be carried out by specially approved doctors, often appointed by the Health and Safety Authority, like the HSC in the UK. The requirements are very specific and legally defined because the potential health consequences are so severe. It's the highest level of statutory health monitoring.
Wow, okay, that distinction is really clear now. Health assessment is situational. Health surveillance is routine for known risks. Medical surveillance is legally mandated for highly hazardous exposures.
So got it.
It's incredible how layered and specific these services can be, really adapting to the exact risks of a workplace and supporting you at different stages of your employment or health journey. So we've talked about this impressive in-house team physicians, nurses, hygienists, technicians, and all the things they do. It sounds like a real powerhouse. But what happens if something comes up that's super specialized, really niche? Can even a well-equipped in-house team realistically cover everything?
That's a very practical point. And the honest answer is probably not. It's
Yeah.
highly unlikely. While a good in-house OH team has broad expertise, the range of potential health issues and workplace hazards is just vast. There will inevitably be situations requiring deeper, more specialized knowledge than they possess internally. So a key part of their function is recognizing their own limits and knowing when and who to call for external specialist support. When a particular issue arises that's outside their direct competence, they'll bring in external experts to ensure the employee gets the absolute best advice and intervention needed.
Okay, so who might they call on? What kind of specialists?
Well, our sources give some good examples. They might bring in ergonomists. These are the real specialists in fitting the job, to the person looking at equipment design, workspace layout, manual handling techniques, repetitive task analysis. If there's a complex musculoskeletal issue or a need to redesign a workstation, an ergonomist is the expert.
Sure.
Or they might need a microbiologist. For instance, in a lab, hospital, or even certain agricultural settings, if there's a concern about exposure to specific bacteria, viruses, or fungi. The microbiologist can assess the biological risks, advise on very specific control measures, perhaps even do sampling to identify the organisms involved.
Very specialized indeed.
Definitely. Then, commonly, physiotherapists. While the OH team manages the overall return to work, a physio provides the hands-on treatment and specific rehab exercises, especially for muscle and joint problems. And another example is a radiation protection advisor. In places using ionizing radiation hospitals with X-ray departments, nuclear facilities, some industrial sites, these advisors provide essential guidance on complying with strict laws and conduct environmental monitoring.
So the OH team acts like a gateway or coordinator for this wider network of expertise.
Exactly. It shows they're committed to providing comprehensive care, even if it means bringing in outside help. It's about getting the right expertise for the specific problem.
That makes perfect sense. It's not about knowing everything, but knowing how to access the right knowledge when needed.
Wow. Okay. We have really covered a lot of ground today. It feels like we've gone from, just hearing the term occupational health to really understanding the depth behind it. We started with that core definition focused on prevention and adapting work. Met the team, the physicians, the nurses with their unique preventative role, the hygienists, detectives, the technicians, and then explored that huge range of activities, the pre-employment checks, the vital return to work support, sickness management, counseling, those proactive risk assessments. And finally, understanding those crucial differences between health assessments, health surveillance, and medical surveillance. It's quite a system.
It really is. And connecting it all back, it's clear how vital these services are. They're not just a nice-to-have or a legal necessity, though they are offered that too. They actively work to promote your total well-being, physical, mental, social, by making work safer and healthier, adapting it to you. It's about preventing problems and fostering environments where people can actually thrive. Ultimately, it's about making sure your working life contributes positively, or at least doesn't detract from your overall quality of life.
So thinking about all this for you, our listener, we talked about those different levels of monitoring assessment versus surveillance based on risk. It makes you think, doesn't it? What are the risks or driving conditions in your own daily life, even outside of work? Are there aspects of your routine or environment that might benefit from a more proactive, maybe even surveillance style approach to your well-being? Could thinking like an OH professional help you manage your own health more strategically? Just a thought to leave you with. We really hope this deep dive has given you a new appreciation for that often invisible network supporting your health and safety at work. And maybe, just maybe, spark some ideas for your own well-being too.